We all know that what is happening now requires social distancing and isolation. And because of this, telehealth has become a really important vehicle for providing health care. This extends to providing mental health services. If we look at the recent past, while telehealth for psychotherapy has expanded, individuals who are suicidal are actually usually excluded from telehealth services. But current conditions demand finding ways to safely work with our suicidal patients during this crisis using telehealth. One of the things that's really important when you initiate contact with somebody who you know to be suicidal is to get exactly where they are located, what their address is at the start of the session. So in the event that you need to contact emergency services, you have that information right then and there. In addition, it would be great if you could have in advance contact information for who is their emergency contact should you need it. And then identify individuals in the client's current environment who can help as monitors for the client's suicidal thoughts and behaviors. And so this can either be in person or remotely. And then one of the things that would be very useful at this particular point is to seek permission to have direct contact with these individuals and, in fact, follow through with that contact. This is a little bit of a trick because most of us are working at home. You need to develop a contact plan should the call and video session be interrupted, and you need to develop a plan for how to stay on the phone or in the video chat while arranging for emergency rescue if it's needed. And I'm saying that that is the ideal. It is actually not possible for all of us to do that. Some of us don't have two phones that we can use. So I guess the underscoring of all of this is you do the best that you can during this time. It's important to remember that risk fluctuates over very brief periods of time. And so brief check-ins can be really, really helpful. If you have somebody who you have found out is currently suicidal and you are trying to help them stay out of the hospital, one of the simplest ways of doing this, and this definitely puts a burden on the clinician, is to have increased contact with that person and to conduct a suicide screen at all contacts. And so as you initiate the contact, you review any changes in risk or protective factors. Is there a change in their health? Or do they have new access to lethal means? Is interpersonal conflict increasing tremendously? Is social isolation and feelings of loneliness increasing? What is actually changing in their lives? And are these having an impact on their feelings of suicidality? And then what we do in one of these contacts is review and update the safety plan. We ask about whether they have used it. If they've used it, did it work? What didn't work? What helped? And then plan for the next contact. And you determine with them, based on the acuity of the risk, when that next contact should be. It could be in the next day, it could be later that day, or it could be in 3 days, or it could, if the person's risk has come down to pretty much very, very minimal, you could say, okay, let's have our next check-in at our next appointment. Now, I just want to stress that this does put an increased burden on the clinician to do these kinds of increased check-ins. But we're talking about in the 10-minute range. And I know from having worked with so many suicidal patients that I would rather do these kinds of check-ins, make sure my patient is safe, than worry about them. And during this time, when many clinicians are working remotely, it's also important to attend to your own sense of isolation. It's important for you as a clinician to get support. Working with suicidal clients, no doubt, creates additional burden in a time of great stress. So clinician self-care activities are really crucial. And so it's important for you to arrange for periods of coverage if possible and allowing for yourself to have time off. And so What we do is we just let people know, our suicidal clients or all of our clients, in advance of when time away will occur, and make alternative provisions to enhance their care and safety. Honestly, clients respond typically very positively and respectfully when clinicians explain that they will be available for a period of time. They recognize that we're people too.